So I'll move on to the general situation and the number of cases that we have, and we'll be having an English language slide coming up. Yes, this one. So I'll talk a bit about this slide. As always, the top green box, as you can see, is the active cases, meaning those still under treatment. So in Thailand, if you ask how many people are still under treatment, how many people still have COVID currently, it's 2,950. Since last year, we had over 13,000 confirmed cases, cumulative since last year. And since last year until this new wave, we have had over 10,000 recoveries, or those discharged already. So doing the math and minus the fatalities, we have 2,950 people currently under treatment. For today in particular, we have 187 new confirmed cases and 95 new recoveries. Unfortunate that I have to announce that we have 2 new fatalities recorded in Thailand for today. The first fatality is a 61-year-old male, British national, having COVID-like symptoms at the local ASQ, local alternative state quarantine. So that's one of those facilities, those hotels in the provinces for foreign nationals to arrive. He was later found to be infected with COVID and immediately admitted to a hospital in Bangkok. And during this hospitalization, he had shortness of breath. That condition worsened until he passed away yesterday. The second unfortunate case, death, is a 56-year-old Thai housewife who had been in close contact with family members with suspected COVID-19. She had chronic and underlying diseases such as epilepsy and stroke, and of course our condolences to the family members of these 2 new cases of fatalities. Just some observations from the summary, the briefing of Dr. Apisamai, that in terms of the global numbers, we always show you the global numbers in the beginning. In terms of the global numbers, right now it's still quite alarming. We have reached over 99 million cases cumulative already around the world globally. So that's almost to the mark of 100 million. While the daily cases in Thailand, in our country, for example, as one of the countries, is more stable without any indication that there will be an abrupt change in that number soon. So although we are stable, we still have to be very vigilant, because I believe, if my memory serves me right, we're now ranked 125, a higher ranking than in the past days. It was 126 in the past days. Now we're 125 out of the 200 countries around the world. So in Thailand, there are now 63 provinces affected with infected cases. And we had the Thailand map shown to you just now as well. During the new wave of COVID, Samut Sakhon, Bangkok, Chonburi were the 3 provinces with the highest number of patients so far. A positive sign is that from a few days ago until today, the 19th to the 25th of January, no new COVID cases were reported in up to 44 provinces. If we look at yesterday and today in particular, the 24th and 25th, there had not been a widespread in terms of location, not in terms of widespread spread of in terms of provincial spread in Thailand as much as in the past weeks. So counting just yesterday and today, the map of Thailand in this regard would be whiter in terms of comparison to last week, that the map was more or less, as you could recall, more or less yellow or red or orange. Okay, so less provinces being affected in the past 2 days. The one important piece of information is that we are accelerating the active case finding in the provinces. We have the time of 12 midnight every day as the cutoff time in terms of the recording of each new case. So I believe that this afternoon there will be another press conference, and that will have some information, additional information regarding the active case finding in particular provinces like Samut Sakhon. The higher number that we get from the active case finding is actually good news because we're rooting out infected persons before they are spread or before they are locally transmitted. So active case finding numbers is very important, and hopefully we'll get a lot of numbers for that and put the persons infected straight into the health system, into the quarantine system. So this afternoon, there might be additional information from this number that I gave you earlier. In Samut Sakhon in particular, we had information relayed to us about the field hospitals, wherein currently around 1,091 beds are available in the field hospitals in Samut Sakhon. Tomorrow, there will be more facilities operational, around 400 more beds, and in the future, 1,000 more beds with the cooperation and assistance from the local administrative organization, the district organizational administration or Obata, as well as cooperation from the private sector as well. So in summary, in Samut Sakhon, there will be up to 3,000 beds in the field hospitals to cater to the situation there. Another point is also that we request for all employers, factories, factory quarantines to take good care of your employees in terms of health as well. So just additional information that might be useful to the English language audience starting tomorrow. This is about the State Railway of Thailand. SRT will suspend 57 ordinary trains, local trains and commuter trains to comply with measures in seeking cooperation from the public to avoid unnecessary travel during this period. These suspended trains are not scheduled during rush hours and will affect the public only in limited form. At the same time, the SRT has announced the introduction of temperature screening at train stations, and all passengers are requested to wear masks. I think that these measures were in place some time ago already as well. And if you plan to travel by train, please do check the timetable of the SRT accordingly. So just in closing, I'd just like to say that the recommendation from the World Health Organization, because at the end of the English language presentation, we usually have some information from our international partnerships. So a recommendation from the World Health Organization, we have 2 slides there. We can go slowly with these 2 slides. While we work towards rolling out the safe and effective vaccines, it's fundamental that we continue our most effective preventive actions at the individual level. So you can see on the slides there some recommendations that are kind of like circulated around the world, those who view the World Health Organization social media. And it's a standard, it's an advice that the World Health Organization provides to people around the world. So the actions at the individual level is very important to suppress the transmission, to reduce mortality. And in areas where COVID are spreading, we have to continue to maintain a distance of 1 meter at least from others. Plus, you see on screen, plus cleaning hands frequently, plus wearing a mask. So it's not only Thailand, it's not only CCSA regurgitating this or saying this every day for our audience here. It's under the premise that it's something of international standard. It's something that every country around the world is implementing. It's something that we all have to take heart to. So this is basically the information that I have, just a recap briefly of the assistant spokesperson's briefing, as well as some additional information for the English language audience for you. So thank you very much for your attention today. I hope you have a very pleasant, very healthy week ahead. On the weekday, it's Monday today. We're off to a fresh start. And as mentioned, by the end of this month, let's see how our intensified measures, intensified active case finding will work out until the end of the month, the 31st of January. where we hope to roll out before that time, roll out the various relaxing of measures, including schools as well. Dr. Pisamai answered a question about schools, wherein we hope that schools will be open very soon. In terms of relaxing the measures, in terms of the analysis that we do from our all the contribution of the public, it will lead to our children being able to go back to school. School will be opening soon, perhaps in February. So we'll see about that. We'll see. We hope that will happen. Thank you very much for your attention. Have a very pleasant week ahead. สวัสดีครับ
ขอบพระคุณนะครับท่านณัฐพานุนพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศครับนี่คือการแถลงทั้งหมดในวันนี้นะครับย้ำเตือนคุณผู้ชมในช่วงเวลา 14 นาฬิกาจะมีการพูดคุยในประเด็นที่เกี่ยวเนื่องกับการศึกษาผู้ปกครองท่านใดที่ยังคงรอคอยว่าจะสามารถเปิดเรียนได้ในช่วงต้นเดือนกุมภาพันธ์นี้หรือไม่และแนวทางในการวัดผลประเมินผลรวมถึงการสอบเลื่อนชั้นจะเป็นอย่างไรติดตามในรายการที่ทำเนียบรัฐบาลนะครับและนี่คือทั้งหมดสำหรับวันนี้นะครับคุณผู้ชมติดตามการแถลงได้ทุกวันเวลา 11:30 น.วันนี้ผมธีวัชชูรัตน์พร้อมทีมงานทุกคนลาไปเลยครับสวัสดีครับ